How do IBS symptoms differ from diverticulitis bowel changes? Imagine your stomach is a busy city. Sometimes the traffic flows smoothly, and other times there are roadblocks or detours. That's similar to how irritable bowel syndrome and diverticulitis affect your digestive system, but they are very different in how they behave and what they mean for your health. Irritable bowel syndrome is a functional disorder, which means it affects how your bowel works without causing actual damage or inflammation. It's like a traffic jam without a crash. People with IBS often experience symptoms that come and go, like cramping, bloating, and changes in bowel habits. Some might have constipation, others diarrhea, and some may switch between both. These symptoms are usually triggered by stress or certain foods and tend to improve after a bowel movement. The pain is often dull or crampy and can be felt all over the abdomen or in specific spots, but it's generally not severe. Mucus in the stool and a feeling of incomplete evacuation are common, but there's no fever or systemic illness involved. Diverticulitis, on the other hand, is an actual inflammation or infection of small pouches called diverticula that form in the colon wall. Think of these pouches as tiny balloons that can get inflamed or infected. Symptoms usually start suddenly and are more persistent. The pain is sharp, severe, and usually localized in the lower left side of the abdomen, although in some cases it can be on the right. Unlike IBS, this pain doesn't usually get better with a bowel movement and can worsen with movement. During an episode of diverticulitis, you might notice fever, chills, nausea, vomiting, and sometimes rectal bleeding or urinary symptoms. Bowel habits can change, but constipation is more common during active inflammation. Diagnosing IBS is mainly based on your symptoms and ruling out other conditions. Doctors look at your pattern of symptoms, physical exam, and exclude structural problems because there's no visible damage or inflammation. Diverticulitis, however, often requires imaging tests like a quart scan or colonoscopy to see the inflamed diverticula and confirm the diagnosis. Blood tests can show signs of inflammation, and stool tests help rule out infections. It's important to understand that IBS does not cause serious complications or damage to the bowel. It's a chronic condition that can be managed with lifestyle changes and sometimes medications. Diverticulitis, if left untreated, can lead to complications like abscesses, fistulas, bowel blockages, or even perforation, which are more serious and may require hospitalization or surgery. In summary, while both conditions can cause abdominal pain and changes in bowel habits, IBS is a functional disorder with intermittent symptoms that often improve after bowel movements and does not involve inflammation. Diverticulitis involves inflammation or infection, causes more constant and severe pain, and is associated with systemic signs like fever and potential complications. Recognizing these differences helps ensure proper diagnosis and treatment. Always consult a healthcare professional for personalized advice, as individual experiences can vary widely.